for a remark and to ask a big favor. Yesterday, Catherine, maybe some can remind, had a quotation at the last slide that only a small group of thoughtful, committed citizens can change the world. We are such a small group. And last year, I've been to the G20. There was a G20 summit in Berlin, and there was a B20 health summit in Germany, in Berlin. I've been there. And there was lots about access to healthcare, access to prevention, access to treatment. And there was not a single word about palliative care and hospice. Next year, it's in Buenos Aires. Maybe some have contact to a health institution in Buenos Aires, to ministry. Ask them to implement some words, some phrases about palliative care. Maybe we can change the world with it. And thank you, Nikolai Pfeffer, for the introduction to the music. He made a CD with Brahms, Johannes Brahms' last masterpieces. Sometimes the best thing in life are very close to the end. And we had this CD for the chairs, and for the speakers, if they want to, we can hand it out afterwards. But now I want to introduce ThomasVaikathuparambil. Thank you. He's from Kerala, South Indian, and there he is the director of the LEVELI health institutions for advocacy, for education, and for healthcare as well. And I found a very interesting sentence on the website of LEVELI institution. Our mission serving society by promoting health and making world-class treatment accessible to each and every person. I think palliative care is world-class treatment. The floor is yours, Thomas.
Yeah, of course. Anche I bambini, quelli più vivaci, dormono a quest'ora. Anche senza ninna nanna, questa è la verità. Perciò noi cominciamo con una preghiera. This is a hymn in Sanskrit. You know the Vedic prayers. It is just like this. Asato ma sadgamaya, tamaso ma jyotirgamaya, mrityo ma amridam gamaya. Om Shanti, Shanti, Shanti. This hymn was written 350 years before Christ from Brihadaranyaka Upanishad. The prayer which we are saying, O Lord, guide us from the unreal to the real. O Lord, guide us from darkness to light. O Lord, guide us from death to life. Peace, peace, peace. Shanti means peace. This morning we heard about the spirituality and the spiritual involvement in the palliative care. I think each religion is bringing this reality. If Lord can come here and respond to us, He will say, what He will say? Now you are here to help my people to guide from death towards the real life. My dear friends, in these days, these 2 days, we heard these things. The spirituality, the palliative care is giving literally strength to our society to learn the value of each human being. Our Pope Francis says, palliative recognizes something equally important, recognizing the value of the person. Literally, it is our duty now to recognize the value of human being. Our Thomas Sitte introduced me by saying I am representing Lizzie Hospital. I think in these days we heard a lot about the policy, WHO insisting to introducing something, and we had a lot. So we have these topics here. I want to avoid some of these because yesterday and today morning we had a lot about WHO policies and how we have to start with, how we have to create all these policies, etc., etc. I'm representing CHAI. You have heard from Father Joby yesterday about CHAI, the group of hospitals and healthcare providers in India. We are giving best care. That was Thomas Hitter said. It is our duty to give best because our founder says always this thing: the poor deserves the best. That is the reality. The poor deserves always the best thing. So any national policy, palliative care policy should align with WHO 6 core components, building blocks of healthcare systems. Let us go forward. Let us see these policies, a government policy, to ensure the integration of palliative care services into the structure and financing of the national healthcare system, an educational policy to provide support for the training of healthcare professionals, volunteers, and the public, a drug policy to ensure the availability of essential drugs for the management of pain and other symptoms and psychological distress, in particular opioid analgesics for pain relief. All three of these measures are necessary along with committed leadership to achieve an effective palliative care program. Yesterday and today, this morning, I heard from our leaders, from these masters, the capacity what they have, the teaching which guide them towards the reality of real palliative care and to make good policy to ensure the real palliative care to each and every person of this world. Let us look the church. We have just seen that video. The Canadian and the American Catholic Church, they are introducing all those things. I think the Catholics are blessed in a sense. Why? Each first Friday, the priest or one minister will bring Holy Communion to the patient who can't move from the house or who can't move from the bed itself. So they have a kind of attention. I think the church, the NGO'S, and all those persons who have the good soul will gather together to do the best thing. Roman Catholic Church is the largest non-government provider of healthcare services in the world with largest health workforce. For example, in India, we have 3 associations. One is CHAI, Catholic Health Association of India. Second one is Caritas India. The third one is the Health Department of CBCI, Catholic Bishops' Conference of India. These 3 structures are creating the best care ever we have seen. Let us, long before the concept of palliative care into vogue, the Catholic institutions are all over the world were taking care of geriatric, sick, and terminally ill patients without discrimination of the basis of place, race, caste, and creed. Their services was devoid of publicity. In Indian health scenario, more than 70% of healthcare services provided by private healthcare centers and hospitals. Palliative care in LEVELI Hospital. Our hospital, a charitable institution of the Archdiocese of Ernakulam Angamali, located in Kerala state. Kerala, you know very well, the southern part of the India. Holding the motto "Care with Love" close to our hearts, we accomplished our mission of providing high-quality treatment of global standard for all and at affordable cost for the less privileged, irrespective of caste and creed. Even in this era where healthcare services are being elevated to a concept of healthcare industry with profit motives, we uphold the following. We do not have profit motive. We do not have a profit-making marketing strategies such as products or service promotions and advertisement. The patients are our billboards. LEVELI Hospital is the pioneer in healthcare services, offering refuge of people who cannot afford to go to the expensive corporate hospitals for the last 62 years. The team of dedicated doctors and staff run the pain and palliative clinic in our hospital. I'm so proud to recognize that our master of palliative care, Palliative India, Dr. Rajagopal, he is the person who instructs our doctors to guide this palliative care in our hospital. Now there are 7 doctors who are guiding this palliative care center. And the relationship between interdisciplinary departments, for example, oncological department guided by the son of Rosakuti Madam, the HOD of the palliative care, they're collaborating in a special way to give the best care to our patients. It is a model to our Chai group of hospitals, and most of the nun sisters and other hospitals are coming to our institute to learn about the system of the palliative care. We are giving free OP and IP home care for all those poor persons, counseling service and spiritual support to the patients as well as to the family, preparing for all peaceful end of life. Patient-friendly environment. A group of well-trained volunteers provide service to the patients from the vicinity of the hospital area and give regular feedback. Let us go forward. Our welfare programs. I have mentioned about Caritas India. Caritas India is a leading non-governmental system, NGO. Now, Caritas India is keen about ASHAKIRANAM project. This ASHAKIRANAM project is a preventive project for the cancer. They are making around 26,000 volunteers who are helping the entire society to learn about the cancer, awareness about palliative care, and awareness about the medicine. And they are guiding these people. Volunteers means they are the persons who are retired from their services. They are doing some other work, college guys, youth from different sections. They are not Christians. Most of them are not Christians. But they are collaborating with us to guide these people to make a better care and best lifestyle. Prevention, awareness, education, early detection screening, proper and adequate treatment, good food and palliation. Now, the concerns. When we are creating these policies, when we are saying about the policies, we have to create the policies to all, not for somebody or some group. Yesterday we heard about the accessibility. We have that accessibility to all. Even in India, I think now the 3% of the patients who need palliative care get palliative care properly after creating all these systems. Yesterday, Father Jovi mentioned, we have around 860 palliative care systems in Kerala only. But apart from Kerala, it is really a situation we can't imagine. That's a real scenario of Indian palliative care. The concern, lack of facility, lack of awareness, misconceptions and myths, lack of health education, chemicalized food intakes, lifestyles and practices, lack of fund in healthcare policy, lack of support system, example, the proper palliative care system. The program tree. Here, we, the Chai, is collaborating with Palliative India. We are collaborating with Caritas India to promote healthcare, especially to train all of these persons who can give better care. Now we are saying about the policy and financial aspects. Why I am here? Our question is this: what I can do, not what government can give, what the policies will counsel to do. What I can do, that is a question we are raising. And we are doing the better service. Caritas India and Lisi Hospital, social mobilization prevention, technical support for education, training for palliative provides, 20,000 community doctors in 5 years. That was the hope of the CBCI. The Bishops' Conference of India is suggesting this to Caritas India to CHAI, and to the office of the health associations in India. So we are collaborating together to achieve this aim. Our educational policy. Now the educational policy yesterday, we have mentioned our central government honored Dr. Rajagopal with Padma Shri. I think if our government will hear our Dr. Rajagopal and our system to introduce a new educational policy, if they are ready to introduce the palliative care education in nursing and for MBBS, for doctors, it will be a great honor to these persons, to the persons who are giving the life for palliative care, giving the life for the life of others. But unfortunately, when we are creating this kind of policy, we haven't any position there. So now we are thinking about our own policy to educate our young people to give best education regarding the palliative care. The rest of the thing, create the awareness to their doctors and to nursing staff, etc., etc. So for the last 56 years, LEVELI Medical and Education Institutions have modeled a considerably large number of nursing and paramedical professionals who are now grown to a state of catering medical services in countries all around the world, spreading the core values of LEVELI Hospital. LEVELI Pharmaceutical, that is the best thing which we have. For the last 48 years, we have one pharmaceutical company. We are producing narcotic medicine. And we are giving the narcotic medicine with the lowest rate. For example, the government fixed the morphine tablet, the rate is 4 rupees, which was the maximum price is 4 rupees. In our pharmaceutical, we are giving with 1 rupee. 1 rupee 10 paise. It means with €1, we will get 73 morphine tablets. That is the count we can realize. What we are saying about all these things? It is our duty when we are saying about the accessibility to the drug. It is my duty to give to our poor patients the medicine. The government, in this sense, they are collaborating with us. They give the license to keep 100 kilo of opium to produce the narcotic medicine. My dear friends, it's a great chance to the Catholic Church to provide this service to the society. When we are saying about the financial perspective, we have the funding system. We are doing all the care which offered by the government. It means the lowest rate the government is suggesting to do, for example, dialysis 660 rupees. We are doing that, and government is paying that much money only. For example, the corporate hospital and private hospital, they'll get 300 rupees, 3,000 rupees. For the transplant of kidney transplantation, we will get 1 lakh rupees. The private sector, they will get at least 4 lakhs or more than that. What we are doing is, in our LEVELI hospital, we are doing this kind of service to serve the poor with the government. We have this particular kind of policy to collaborate with the entire system to be a model in our healthcare system. The future palliative care, the future of the palliative care witnessed a patient care explosion, palliative care explosion, of course, because we have a lot of patients. When we are saying about cancer, when we are saying about other diseases, we need palliative care. We have to create the increasing population of older people, rising incidence of cancer as well as cancer-afflicted living longer, and above all, the recognition of supportive and symptomatic care requirement explains this explosion of needs. The country. When we are saying about the policy, we have to assure one thing. I don't know, yesterday my friend from Africa says that if WHO create one policy, we are satisfied because we can bring it in front of the government. We are in Kerala. The last session of our assembly passed the Clinical Establishment Act. Only in the last session of the assembly, they passed the Clinical Establishment Act. What I'm saying is these policies and all these norms and regulations which world has, it is a desire, it is a future. We have to achieve these things as soon as possible. When we are saying about the percentage of the people who can access this care, it is only 1% or 2%. We have to think about this 98%. So, my dear friends, it is our turn to do something to get best care, to give the possibility to access to the medicine, to the care, etc., etc. Now, what can the church and NGOs do? We have heard a lot about this. We are here. I have to congratulate our Monsignor Vincenzo Paglia and the team for this best gathering where they are creating a core team. The world is here, no doubt at all. The world is here to hear. The world is here to bring the message, to pass to our leaders, to our government sectors, to our NGOs, to our youth, etc., etc. How can we reduce the cost of palliative care? We have heard from our economist how we can reduce the cost. In India, we have a model that is called ASHA, Accredited Social Health Activist. That's from the part of the government. They are keeping in each village a social worker who will take care of these poorest patients, who will take care of all these situations. But it is not well practiced in all sense. But it's a very good community health project and program. A 24-hour helpline we are introducing among our hospital. We have around 300 systems in Kerala only. We are creating one 24-hour helpline. So, if one patient is in need, has the problem, he can call and the doctor will go to that particular house and give help. The volunteers are giving the help to bring this particular doctor to that house. That is the helping system which we have. More people from general population must join as volunteers. When we are saying about the volunteers, I have in our hospital more than 780 volunteers who are giving their time, their money. That's the most interesting thing. Most of them received the care from our hospital. Most of them had palliative care patients in their house. After receiving this care, they are taking care of other patients. That is the best thing which I have experienced in the system. If our volunteers have time, have money, it is not money because they have money in their pocket. What they are doing? They are doing some other works. For example, college students are going to help the hotels in Sunday. On Sunday, they are going to hotels and they are bringing that money. We have CSR projects from the biggest group of corporate sectors. They are giving money to the palliative care system. So, my dear friends, if we have the capacity to announce, we are here. If we are transparent, our people will come. They need leaders. They need good persons who are giving the possibility to do something for others. That's the most important thing. I am concluding. Here there are some points. We are already facing barriers of need supply deficit. Yesterday our friend from Ireland was speaking about the necessity of nurses. I think from Kerala, now we are running around 120 nursing colleges. We are sending a lot of nurses all around the world. In Ireland last year, I think 1,500 they are recruited directly from Kochi only, the nurses. We are sending these persons. So the major part of the nurses or clinical service person are going from our place. Now what we are doing? We are creating volunteers with the help of Caritas. Who are these volunteers? These persons are working, 1 minute, our persons are working in our diocesan setups, SHG members, self-help group members. They have their own work. they have their own market, they have their own earning, but they have enough time to spend. They are creating a network system. This network system is functioning very well. All of the dioceses, we have 30 dioceses. We have more than 75,000 volunteers from different dioceses. So my dear friends, what we are doing now, we are creating this kind of service, we are creating this kind of policy, we are making money. We are not poor, we have enough money. So, palliative care everywhere and by everyone. This is our theme of this congress. I think to do this, we are going forward. We are synchronizing with all agency. We are doing all the best practices to give health care, palliative care to everyone. Thank you.